Alexander intelligently navigates our suite of healthcare intelligence applications, turning diagnostic reports, policy rules, eligibility, authorization, claims, remits, and clinical history into actionable intelligence that helps get the initial 837 claim paid correctly on its first journey and reduce denial rates from roughly 14% toward 5%. In under 3 minutes, Alexander will receive a diagnostic report, route it to the correct healthcare engine, open the results screen, return an auditable answer, and let the user jump back into the app to verify the work. Here, the user selects the diagnostic report intelligence process inside Alexander. Then the Echo report is attached. The question is entered directly into Alexander. Process the Echo PDF, return observations, CPT and ICD suggestions, modifier review, gap review, and the route audit. This matters because Alexander is not guessing which app to use. Alexander is routing the request to a real deterministic healthcare process. Once the command is submitted, Alexander calls the Diagnostic Report Intelligence Engine. The engine processes the document, creates the batch result, and automatically opens the healthcare application screen tied to that exact run. This is the power of Alexander Command Intelligence. The user asks once. The correct engine runs. The correct app screen opens. And the result is auditable. Now the Diagnostic Report Intelligence screen is showing the processed Echo report. The app displays the extracted observations and the key intelligence layers. CPT and HCPCS draft signals, ICD diagnosis signals, modifier review, and gap or denial prevention review. The document is processed through a deterministic engine, and the results are organized into a healthcare workbench that a coder, RCM team, or provider can review. This is where the move from a 14% denial rate toward 5% gets its power and truth. By catching documentation gaps, coding issues, policy risks, and claim readiness problems before the initial 837 claim begins its first journey. Alexander's response matches the application output. That is important. Alexander is not replacing the healthcare app. Alexander is coordinating the process, explaining the result, and preserving the route audit so the user can verify what happened. The database and the app remain the truth layer. Alexander becomes the command intelligence above them. From inside Alexander, the user can click back into the exact result screen. That means Alexander is not just giving an answer and ending the workflow. Alexander connects the question, the deterministic engine, the database, and the visual review screen into one controlled experience. For healthcare teams, that means faster review, faster validation, and clearer auditability. This same command intelligence architecture can route more than Echo reports. It can support diagnostic reports, EEGs, imaging style reports, clinical notes, claim files, remit files, eligibility data, prior authorization records, denial intelligence, CMS policy review, and executive healthcare dashboards. Alexander is not just answering. Alexander is orchestrating. Deterministic engines, real database, real results, auditable healthcare intelligence, controlled through Alexander Command Intelligence.